Haley's done her adjustment. She's done her dry needles. Doing her laser now on her low back. This laser will utilize the increased blood flow from the dry needles, which will promote the tissue recovery. It's very soothing as well. Kaylee, is that good?
Yeah, it's good.
Awesome.
Usually bother you over here at all?
Not quite.
Really
out
just in
that
here?
far, yeah. So
Got it.
if you drag it even just a little bit more right through there, you can kind of feel
Yeah, I do.
through the pressure. You can feel that kind of knot. Yeah.
Definitely. You cool with a little pressure?
Yeah, absolutely. So the cool thing with ribs is that they typically resolve pretty quickly. You know, within the first couple handful of visits. The bad thing about ribs is that you're always breathing, so you feel it a lot. So it can definitely drive you crazy, but with the appropriate treatment, they go away pretty quick.
Those deep inhales been bothering you?
It's not, yeah, not even really with that. You know, I'll catch it with every so often with just normal inhaling too, but it's kind of been off and on through that region for a while. So,
Gotcha.
I can only imagine how annoyed that area is with me.
Absolutely. It's actually one of my favorite modalities we have here. I've treated almost a lot of things on my body with this.
Laser's powerful stuff, especially in the I guess both acute and chronic patients we see. It's it really kind of helps get them over that threshold and heading in the right direction.
100%.
A little less invasive than needling, but needles is potent in its own way.
Boom.
Thank you so much, Christian.
Of course. I actually prefer you to lie on your back. Yes. There you go.
He's a weird one.
What? How do you do it? I'm gonna push this down right there. Alright.
Is it hot instantly?
It's warm instantly.
But it doesn't get hot.
And that, if you stop it, it just got hot, and it gives you a little red sign.
Like, hey, don't do that. Okay, yeah.
It gets pretty warm.
This is fine. I was like, this is fine. But also, I literally, that's exactly what I said. I was like, but also what?
Is it kind of like a heating pad vibe after you get your like adjusting the modalities done?
Yeah, a little more deep, a little more focused. It's definitely been it's a different process in terms of how it stimulates the cells. That was really warm. But yeah, it's similar to that, what it feels like from a deep heat standpoint and a moist heat pad.
So yeah, we just like walked on. No, these have shapes. Like is that this?
But like we did like a joint continuing education with the Baltimore Orioles and with Johns Hopkins, and it was about the interdependence of the hip and the lower back as it relates to treatment and understanding. Like if you got low back pain, look at the hip. If you get hip pain, look at the low back. In essence, and Ken Johnson's his name. He's a wonderful physical therapist with Johns Hopkins there, and he runs all their outpatient facilities. He's an awesome guy, and he's been like a really great source of information for me as a clinician. And he's just stayed so professional and connected with me over the years, and I couldn't say enough nice things about him. But the majority of the presentation was actually on tissue repair and when they treat things, what they like to do to combine therapies together. And like I got a lot of good exposure to class 4 lace therapy, and he used that in his presentation. And he talked a lot about how he uses it as an adjunct at the end of a lot of things to stimulate what he was trying to accomplish, basically. The way I describe it to people that are curious, it's like fertilizer to what we're doing. It's a stimulant. It helps repair, helps change, helps challenge the sensation of pain, and as well as get better results. So we use it quite a bit. We use it with the Orioles. Now we use it here with patients, and we try to create all the good modalities that we use down there and more of a structured, efficient way to take care of day-to-day problems. Real life problems.
All right, Kaylee's on her adjustment. She's on her dry needles. Doing her laser now on her low back. This laser will utilize the increased blood flow from the dry needles, which will promote the tissue recovery. It's very soothing as well. Kaylee, is that good?
Yeah, it's good.
Awesome. So if you feel like you need to get in for some treatment, come on down. We're ready for you.
You lied to me. You lied. There it is. There. No. It's not getting warm, is it?
I mean, it's warm, but
It's not like bad.
Yeah,
Let's just keep it at that then.
it's getting a little warm.
Warmer.
Yeah, like
We'll drop it down just a bit for you. Let's go 3.5. Ready?
3.5. What?
You were at 5?
Oh,
Yeah. You're pushing the goggles.
they won't. My cheekbones want to raise them.
Still okay with that? Oh, there it is.
Ah,
I found the sweet spot. No, I'm just kidding. I lied. You moved. Got a minute left. You cool with that?
Yeah.
What's the plan this weekend, Maddie? What are you getting into?
Oh. Friday. No.
It's Thursday
It's
today.
It's
yeah.
the needles. It's the needles.
Sure.
No. Saturday, I'm gonna go see my little cousins and my aunt and uncle, and we're gonna have a little craft night and some din-din. And then Sunday is my friend's birthday. She's my friend, but she's my boyfriend's sister. It's her birthday, so we're gonna do a little din-din, and then that's it. I don't even know what I'm doing Friday.
What sort of crafts are you gonna be doing?
I hope clay.
Clay. That's an intense craft.
It's legit. But I made this really cool guy last time. He was a triangle, and he was wearing a party hat, and he had these big bushy eyebrows. And I named him Sat at My Own Party. I'll show you later.
Okay.
It's actually kind of cool.
All right. Erin, you ready for this?
Yes.
She's gonna be feeling kind of like a deep a warm massage is what it's going to feel like. Let me know if it feels too hot at any point. And we're just going to roll right over that area we were describing earlier. For her, it's kind of rhomboids in that medial border of her scapula. That feeling all right so far, Aaron?
Yep.
Cool. Thanks for tuning in.
Basically, it's just a glass ball, just rolls over the area, and as soon as I hit the button, it'll start. It'll just get warm. It might be a little cold to start just because the ball is not been used in a while. The laser emits light, uses light therapy, so it gets a little warm on the patient. So we always ask them to make sure it doesn't get too warm, or if the pressure's okay or anything like that. Benefits of laser: it helps with the muscles recover. It brings blood to the cells, helps bring in nutrients, all that stuff that the muscles need to recover to build better, faster, cleaner. But is this all the areas that's bothering you, like up in here and down a little bit, Bill? The only thing with laser, like, if someone has a tattoo in the area that's bothering them, like, you might not be able to do it just because if you roll over it, it could burn them with the tattoo. So that's just one thing that we're kind of precautious about. Usually, like, scars and all that other stuff, like, we can go over. Yeah. It's not too warm, is it?
No.
Okay. All right, ready?
I'm ready.
Might be a little chilly. She's saying all up in here, all over here, and all down here.
Yeah, so the anterior deltoid, the middle delt, and a little bit of that, a little bit of the bicep tendon, but mostly it's in that deltoid.
Mm-hmm.
You know, it hurts when I go overhead. And, you know, if I was adjusting someone from, they were lying on their stomach and I was adjusting the mid-back and I would push gently into the mid-back, it would really get my attention.
Really bark at you. Dr. Jeff?
Do patients ever try to grab the wand from you? And
No.
show you where it is? They don't?
No, as soon as they start to like move or everything, I pause it because if you stay on them too long, it burns them.
Mm-hmm.
So I just turn it off because I don't really feel like burning them.
Yep.
So I asked before they get on the table to very clarify where everything is at.
Yes.
Sometimes it's easy because like if they just got dry needled, you can see where the needles were and you're just like, oh, the same spot where your needles are, you having discomfort? And they usually say yeah,
And
but
you can see some of the needle marks.
yeah, you have a little dot right there.
Yeah, Jonathan would have to be pretty good. He was getting creative. He had the deltoid, the biceps tendon, the pec minor, the middle of the belly, the insertion.
Yeah, right there. I see your little spots. It's crazy.
So now that's the line right there that I really feel it, right?
In here?
More towards the middle, over this way a little bit more.
This whole thing?
Yeah, right there. Right now you had it. Now go back over that way. Yeah, like right through there. Do patients ever talk to you that way?
Yeah.
Yeah.
Especially like the shockwave.
And I'm doing everything in my power to not do what?
What?
Reach out and grab the wand.
Oh, yeah. Reach out and grab it and do it your own. You like having control. Well, it's because it's hard because you know where your spot's at. And if I'm not hitting it, you're like...
You're hitting it right now. You're really focused on the area.
All right.
That's awesome.
I'll just keep going up and down.
Yep, there you go.
If it ever gets too warm, you let me know.
Okay.
What's your favorite adjustment to do, Dr. Jeff?
What's my favorite?
Yeah.
Oh, I think what we call the occipital lift.
Oh, lift?
That's the money.
I've never
And
seen
then-
you do that before.
And then the one, sometimes when we have let's do that again.
Okay.
Let's reset it.
Okay.
Yeah. So right there, that's the sweet spot, right along there. Within an inch,
This
an
way?
inch on each side of that line you had, yeah,
Okay.
that's where it is. Yeah. So that one and the one where you, the patient's sitting on that bench outside in the,
Oh, and they drop down.
and they put their hands on top of their head and they roll back. That one's amazing for anybody who has a rib that has gotten stuck in the wrong position,
Mm-hmm.
or anybody who's having mid-back tightness, stiffness, or discomfort. It's just so effective. I used to use that technique all the time on some of the professional baseball players that I've taken care of over.
Gotcha.
And that's a
They
big
loved
one,
it?
yeah. And I think anybody who works
I
at
think it's so satisfying.
at their desk all day, they're just rounded shoulders, their heads down. You know, I've taken people before and checked their range of motion that's restricted, and then adjusted just their thoracic spine, and with that hands over head technique, even from the top to the when they're lying face down, even that adjustment. Then you check their range of motion, and you can see
It's crazy.
a really nice improvement. Yeah, so it all goes. It's all connected. The one above, one below, and that kind of thing, right?
Mm-hmm. I feel like you get a lot of cracks. I feel like it's very satisfying. Because even like sitting out here, sometimes you can hear it go, and you're like, "Ooh, that's
Yeah,
a good
But
one."
the suboccipital lift, not many people are competent in doing that technique, and I think all the doctors here have mastered that technique, right?
Yeah, I've seen Alec do it a
And
lot of times.
It's amazing for headaches. It's really, it complements the dry needling that goes along with treating headaches, right?
Mhm.
It's just a good way. Like, I don't get excited about the cracking or popping. I get excited about finding an area that does not move correctly.
I think
So something that's stuck.
Mm-hmm.
And when you do the occipital lift, what you're doing is you're getting motion to where the suboccipital region, the bottom part of your skull, sits on top of the first cervical vertebrae.
Mm-hmm.
And if that area is not moving, that is significant, right?
Because you're literally stuck.
So all of a sudden, their flexion and extension motion really improves. Thank you.
Of course.